Okay, back to Heather for a minute. You are where on your recovery after cancer?
I'm 3 years out, 2 years cancer-free, but still using chemo 5 days out of every month for maintenance, so it doesn't come back.
Are you high right now?
No.
How often do you have to smoke the marijuana to...
The week I take it, maybe...
Chemo, you mean?
Yeah, the week I take my chemo, I might need to smoke twice, and the week after, I might, on average, twice. Some rounds are worse than others. It's very unpredictable, but the most predictable thing is I will need it at some point during each round.
Is it pain management and appetite, or strictly appetite?
It's appetite for me. There was a point where it was pain management, it was both, but now I'm to the point where my body has gotten a little more used to the rounds of chemo. I mean, I've been on it for 3 years. So now it's more of a factor of easing the nausea and helping my appetite.
To get it now, your doctor cannot prescribe it. You've got to buy it from a dealer.
Yeah.
Somebody who you know and trust, so that you know you're getting something.
Yeah, and it's still a roll of the dice. I still don't know what I'm getting. It's not regulated.
Do you worry you may get busted?
Oh, absolutely. Every day. I don't go many places without it when I'm, on the chemo or the week after, because of the fear of getting very ill and not having it. I mean, I don't want to feel that way.
And you would have been a person, I think you told me before the taping, you would have been a person who would have preferred, frankly, to drink, for instance, in college, rather than get high.
By far. And we also talked before, as patients, you learn how to smoke in a way that you don't get high. You get the medicinal effects without getting the high effects of, feeling loaded or, out of your, self.
Andrew, a couple of things. There's been discussion that if this were to go into law, that employers could no longer toss you or threaten your job if you were high at work.
Right.
If you have a medical... Is that true or false?
That is not true. Absolutely not.
That's been reported.
It was... I actually had a discussion with that reporter about that, and I think that there were a couple paragraphs in there that were misleading, and that wasn't his intent to try to convey that.
So a loaded person in the workplace would still be subject to...
Correct. What our initiative does say is that if you are a medical marijuana patient, you cannot be fired from your job just for testing positive on a drug test. Okay. So, like, if you had smoked 2 weeks ago, if you were Heather and you were subject to a random drug test, just because you had smoked marijuana and it was in your system, you could not be fired because of your status as a medical marijuana patient.
Different than getting fired for being loaded at work.
Oh, absolutely. And actually, not only that, the initiative language states specifically and clearly that employers are fully within their right to terminate employees if someone is intoxicated on the job or if they're possessing marijuana on the work site.
A couple more things, and I want to keep just a note to the director, Ellis. I want to keep the time as equitable as we can here, because we're going to have Shelley Mowry, Partnership for a Drug-Free America, on in the second segment. So just try to keep the time as equal as we can. Could you grow your own under this?
Only if you live more than 25 miles from a licensed dispensary. When we designed the initiative, we wanted to make sure, we had 3 goals that we were trying to achieve. We wanted to make sure that we had the best patient access that we could, that somebody who had never smoked marijuana before in their life could, if they needed it, be able to go to a facility and acquire their medication with minimal hassle. The second thing was we wanted to keep costs down as much as we could, so that patients aren't paying street prices for medication that they need to save their life. And the third thing was we wanted to design a law that would not have impacts on society more broadly. It would just be something that could service patients. It would exist mostly transparent to the rest of the community. And so the HALO rule that we called it is basically to discourage urban growing. We don't want to cause a law enforcement concern. So if you're within 25 miles of a dispensary, you have to use the dispensary. But in order to serve patient access, if you live more than 25 miles from the dispensary, you can grow a limited number of plants for your own personal use.
Just that's for convenience, so that you don't have to go into the city always to buy it or whatever.
Correct. Well, many of these people are very, very ill. I mean, and that would be a significant burden for them or for their caretaker to have to travel into town weekly or bi-weekly to be able to get their medication.
So you can look me in the eye and tell me and everyone watching that this is not about decriminalizing marijuana ultimately. You're saying this is strictly about patients like Heather.
This is about protecting patients from arrest and prosecution. And I'm more than happy to have the discussion about marijuana prohibition more generally, but if we're going to have a war on marijuana, let's at least take the sick and the dying off the battlefield, and that's what this initiative is about.
Final word, Heather, to people who are maybe on the fence and don't know what to do about this vote. which I think is coming. We don't know. It's not on the ballot yet, but I think we will be voting on it.
I just ask that they think about the people that really need it as patients. Wipe out all the other things that are going through your mind and just think about the people who are suffering, who are fighting for their life, that really benefit from what medical marijuana can do for them.
Thanks for joining us on Newsmaker Sunday, Heather. And when we come back, we're going to have Shelley Mowery from the Partnership for Drug-Free America. And at the end of the program, we'll preserve a little time for Shelley and Andrew both to have kind of a final word on this as we debate medical marijuana in Arizona. Back in a minute.